Hi, Kathy. So great to have you here. The American Medical Women's Association really appreciates your willingness to share your story and your journey in sleep. Do you want to just introduce yourself to us?
Yes, first of all, thank you for having me on here, for me being able to tell some of my story. My name is Kathy Page. My husband and I live in the middle of Missouri. We have a cattle farm, and I am involved in church activities, and I am the co-founder and current chair of Alliance of Sleep Apnea Partners. And so I am involved in sleep apnea and that kind of thing.
So I'd love to know how you got to that role, but if we could backtrack a little bit so that we could just get a sense of when did you first suspect that you had a sleeping problem?
It was years ago. I was a mother of three children. I went into my doctor and just told him I was fatigued all the time. I was so tired. And he told me that, well, I was a mother of three children. Of course, I was going to be tired. And that's all I got from him. It wasn't until a few years after that that I realized I had restless leg syndrome, and that affected my sleep. And I was on medication for that and doing fairly well. But I still was not sleeping well. And so I went to and had a sleep study done in a lab. And when I came out, instead of giving me information about my restless leg syndrome, the doctor said, your oxygen levels dropped to 86%. And for me, not knowing anything at all about sleep apnea at that point, I thought 86% was probably a pretty good average. But he told me that I needed to see another sleep doctor closer to home, and I needed to be fitted for a CPAP machine. And that was something I was not going to do.
Why were you not going to do that if that was what they recommended to manage the apnea?
Well, for one thing, they didn't really say how serious it was. They didn't say what 86% oxygen level meant. They didn't tell me anything about sleep apnea. They just said I needed this mask. And I had seen pictures of the masks, and it was one of those things where I didn't want to wear one. I didn't want to have my husband see me wearing that. Um, and it was just the whole idea of it was just, no, I'm not going to do that. And so I finally, a friend of mine suggested that maybe I should check into it a little bit further. And the sleep doctor that was closer wouldn't see me at all until I'd actually been fitted for a mask. So I knew that I had to do it whether I really wanted to or not.
And so did you go ahead and seek that care out?
Yes, I did. I went into the local company that dealt with fitting CPAP masks. And the thing about it is, I still didn't even know what I was going in for because they told me that I could start out with a sleep pillow. Okay, a sleep pillow, a nasal pillow is what they said. And it's like, how is that going to help me? How's a pillow going to help me with CPAP? I didn't know what it really was, didn't realize what kind of apparatus it was. And so I went in and I tried that, and that didn't work. And I tried some other masks, and I finally decided that a full face mask would do best for me. And so they fitted me for it, and they told me that they had fitted it correctly, that I was not to tighten it. I was not to do anything with it. They showed me how to turn the machine on and off, and then they sent me home. And the other thing was that they put it on me and fitted me with that while I was sitting up. Well, when you go home and lay down, it fits totally different. And so there were a lot of leaks, and it was uncomfortable. And I just hated the whole idea of it. And I didn't wear it for a long time.
So, but the whole purpose of you getting fitted for the CPAP mask was so that the sleep doctor close to you would see you. So did you
Yes.
call that doctor and make an appointment to actually learn a
Yes.
bit about your apnea?
Yes, I did. And by that time, I was wearing the mask most of the time. And so I went into him and I told him, I said, I'm still don't feel like that I'm getting good sleep with the mask. And he pulled the little SIM card out and he said, well, I can see that you're wearing it like, 7 hours at night. So you're doing fine. It wasn't until afterwards that I realized the question I should have asked him was, okay, I'm using the CPAP machine, but I'm still not sleeping. So what is that issue? And then the one thing that he told me, he said, because he used a CPAP machine himself, he said, at night I go home and I wash my mask out with lavender scented dish soap. And he said, I just drift off to sleep. That was no help for me. That was no help at all. And it was basically like, well, I don't know why you have a problem. I don't have a problem. Um, there was no support. There was just absolutely no support, no one to go to ask questions of. Um, I hadn't found any support groups online to ask to see how other people were dealing with it. It was just a horrible experience.
So how did you manage to get some relief from your sleep apnea? And how did you even learn what the condition was and why you even needed care for it?
Well, being in the middle part of Missouri, we don't have support groups, we don't have doctors close. So I started looking on the internet, trying to look at reputable sources and trying to find out information. And that's when I found out that having sleep apnea can cause all kinds of other problems. It can make current problems worse. It can cause other problems. By the time I found that out, I had type 2 diabetes. I had AFib, sleep apnea, the restless leg syndrome, and some other heart issues, and became overweight. And, it's one of those things where if I'd known about that ahead of time, maybe I might have been able to avoid some of that. But that's a question I'm never going to be able to answer because I just don't know. I don't know. Some of that is hereditary and some of it's made worse by having undiagnosed sleep apnea.
Have you found that your sleep issues have changed over time with your age?
With age, that makes a difference. And I can honestly say that I use my CPAP faithfully. I do. I travel with it and all of that. But I can't honestly say that I sleep any better or I feel any less fatigued. And I do have finally broke down and I have an appointment with a sleep doctor. Unfortunately, it's the same one I saw before with the lavender dish soap, but he's the only one close. And so I'm hoping that he will put me through another sleep study to see if the machine is working the way it's supposed to be, if the pressure is okay. Um, and if everything's fine there, then I need to look somewhere else and find out what the problem is.
Um, have you found that your sleep trouble has affected your work or your social interactions?
I am retired, but I was on the CPAP while I was working. I worked for 24 years for an electric co-op, and we worked 4 10-hour days. So we were at work early and we stayed late. And yes, I would get extremely tired. Of course, you can't take a nap while you're working, but the days that I had off then we're normally trying to catch up during for whatever you didn't get done during the week, but so tired. And yes, there were, and there still are times when we have plans with friends or a social outing of some kind that I cancel because I'm just too, too tired to enjoy it.
So you have both restless leg and sleep apnea, and you've followed the course of action that you've been prescribed for both conditions, and yet you still don't feel that your poor sleep has been well managed. That's a long time to struggle with a condition and not feel some relief.
It's just so hard to know where to go to get help, especially for people in rural areas. The closest big hospital is 3 hours away, so that's a 6 hour round trip. And then you have to be referred to a doctor. Well, if your local doctor is not aware of someone to go to, then where do you start? And then if you get there, what if that doctor is not going to work out? It gets very frustrating. And eventually, I know for me, until just recently, I just gave up It's just like, this is the way it's going to be. Um, I'm just going to have to live with it.
That's a little distressing considering you're someone who now works for a sleep apnea organization to advocate for patients. So, what has your working for a sleep apnea group helped you understand better for yourself, and maybe something that you can share with us for others?
I think the main thing that I found out with working with the sleep apnea group that I do is that I'm not alone. I'm not the only one that is dealing with this. And so if I'm having issues, other people are having issues. And if I can't get my life straight, then I can't ask others to try to do the same thing. So I use the information that's on our website to help out. I created some of that because of the issues that I've had. It's just one of those things. I guess you have to practice what you preach. And in my case, it's I'm having to figure out that I can't just keep going this way. And as you said, I can't be a representative of an organization that wants to help others if I'm not willing to help myself.
So, tell us the name of the organization.
It's the initials are ASAP, ASAP, and it's for Alliance of Sleep Apnea Partners. That is a group that we started several years ago with just a few patients that we wanted to bring information together to help other patients, information that we had been lacking, the just to help people out. And it is grown now, and we have an executive director, and we are going more in the advocacy area, although we still are doing education. But we're just trying to get anything together for the patient to help them support them in their journey.
So, because we're sharing this with physicians, what might you share with us to encourage physicians to help treat or manage or listen to their patients a little better?
I think the one word you said there is the one that needs to be highlighted, and that's listen. Actually, listen. And by listening, it's not just with your ears, but it's with your eyes and with your mind, to take in the whole patient so that you might pick up on something that they don't even realize. Um, and ask questions. You know, don't be afraid to ask questions to the patient, because sometimes the patient doesn't even realize what information they might be able to share with you until you ask a certain question. I've told patients too, I said, instead of just going into the doctor's office and saying, I'm not sleeping, this isn't working, do a non-sleep diary. What did you do during that day? What did you eat? Did you exercise a lot? Did you have a lot of stress? What time did you go to bed? When did you take your medicine? Did you wake up? What time? How long? Those kind of things, because that's more concrete information to give to the doctor so that they can look at it and see what's going on, and you're not forgetting anything. It makes it just more, I don't know, more real for the doctor so that they can see a little bit better. And it also helps the patient um, remember what's going on in their lives too, because it's easy to forget. Okay, two days ago I had a really horrible night, and this happened. And if you write it down in this, it can take it with you. I think that helps the doctor and the patient.
So, you said that you have diabetes, so you're clearly seeing a physician to be managed for your diabetes. You mentioned you have some heart conditions that need to be managed. And so, have either of those doctors explored the issue of sleep with you?
The heart doctor, no, no, neither one of them really have. It just seems like it's such a separate issue that I don't think about saying, hey, along with this, I'm not sleeping well. Does this have anything to do with it? you would think that after having this all these years, I would have my act together, but I am still learning on what I should do and what I should not do. I'm finally in with a neurologist. We didn't have a neurologist around here at all. And he's probably helping me as much as anything with this. Sometimes it's a doctor you wouldn't think that would be that interested in your symptoms that really takes hold and helps. And he has been a tremendous help with all of this. So it's hard, it's frustrating to find the right doctor, someone who's going to listen and to get your information across to them.
So if I can take what I heard you say, it seems that we should encourage every patient to ask any doctor they go to. They should mention that they have sleep issues, that they're struggling and don't feel they're well managed, because we know that sleep impacts all of these conditions and also impacts weight gain. So, you look at all the things that you're struggling with, and I wonder how well you're managed overall, with all of these conditions when they're looked at together as opposed to separate conditions for yourself.
Yeah, I mean, it's hard for any doctor to, if I go in about my AFib, that doctor is concentrating on that. And he may not think to ask me about the restless leg syndrome or anything else. So I'm not blaming the doctors. It's totally really up to me to bring those situations up to the doctor and say, oh, by the way, I'm having this. Does it have anything to do with AFib or with my type 2 diabetes or whatever? They're all aware of the other issues that I have, but taking them into account to see if that reacts with something else that I have is not something that they do, and should be on my radar to bring up.
So you mentioned that you are encouraging people to ask questions. Are there certain questions that you feel that maybe your physicians should be asking you so that you don't have to try to think about those things yourself?
I think if if a physician would start with a general question, like, how have you been feeling? What symptoms have you had that aren't related to atrial fibrillation? Um, how are you managing those? Just those types of questions, because, if I go to one doctor, I don't tend to think to talk about anything else problems I'm having, unless they're major. And because we're there to see a diabetic doctor. We're not there to ask him to treat us for AFib. That's not our position there. So I think a lot of times it's well, we're just going to talk about the diabetes. We're not going to talk about anything else. And if the doctor draws that out, to let them know that it's a totally rounded, well-rounded situation. Your health it's all interconnected in some way. I think that might help the patient understand that it's all important and to be more willing to bring those things up to the doctor. Again, I'm not blaming any doctors. Um, it's an education thing for both doctors and patients. And that is the one thing that I preach. If you have an issue, learn all you can about it from a reputable source so that you can start a conversation with your doctor. Because it's not just the doctor asking you questions, it's you asking the doctor questions. And you have to know what you're talking about. Doesn't mean you're there to tell him how to do his job or her to do her job, but it's your health and you need to be educated about it.
And I have one last question. When you went through menopause, did you find that your sleep apnea changed at all? Did it get better or worse? Did your restless leg get better or worse?
My restless legs got worse. Otherwise, I went through menopause very easily.
Mm.
So I didn't have a lot of other issues that went along with it. The only thing it majorly caused issues with was my legs, with the restless leg syndrome.
And were you able to get kind of revised care to help manage it better?
Not really. It's this medicine should be good enough to take care of you, and for the most part, it was, and it is. Those nights when they act up, just get up. Just get up and walk and do something to take your mind off of it. More medication isn't always the answer.
So you're trying to find ways to manage your restless leg, but you're doing the CPAP every night and still feel the fatigue. Is it better than how you originally felt it?
Yes, I would say before I started treatment for the restless legs and the CPAP, um, I was a lot worse off, a lot tireder, but I'm still, it's not taken care of yet.
Well, we're glad that you're pursuing it, and we hope that this next visit will help you get to the bottom of it. I hope you'll ask a lot more questions and, really advocate for yourself so that you can come away feeling that your care has been best managed.
Thank you so much for letting me be a part of this.
Thank you for sharing your story and your information. We hope that it will help other patients, and we hope it will help physicians help their patients too. Have a great day.
Thank you. You too.